Here's another practice test with correct answers and explanation. Good luck. Assessment. The nurse is gathering data from a client with heart failure. Which finding should be reported to the healthcare provider immediately? A. Bilateral 1 plus pitting edema in the ankles. B. Weight gain of 3 pounds in 24 hours. C. Complaints of occasional dizziness when standing. D. Crackles heard at the lung bases only on inspiration. Diagnosis. A client with chronic obstructive pulmonary disease reports shortness of breath when climbing stairs. Which nursing diagnosis is most appropriate? A. Ineffective tissue perfusion. B. Risk for impaired skin integrity. C. Impaired gas exchange. D. Activity intolerance. Planning. A client with diabetes mellitus states, I don't understand why I need to check my blood sugar daily. What is the best nursing goal for this client? A. The client will adhere to dietary restrictions. B. The client will verbalize the importance of blood sugar monitoring. C. The client will demonstrate proper insulin injection technique. D. The client will engage in physical activity daily. Implementation. The nurse is reinforcing teaching with a hypertensive client about reducing sodium intake. Which statement by the client indicates the need for further teaching? A. I will limit processed foods. B. I will use salt substitutes instead of table salt. C. I will read nutrition labels for sodium content. D. I will avoid canned soups and frozen dinners. Evaluation. The nurse is evaluating the effectiveness of pain medication given to a client. Which statement indicates that the medication was effective? A. My pain is 2 out of 10 now, it was 8 out of 10 before. B. The pain medicine makes me feel sleepy. C. I will ask for pain medication again later if needed. D. I feel better when I'm resting in bed. Assessment. The nurse is collecting data from a client with pneumonia. Which finding requires immediate intervention? A. Temperature of 101 degrees Fahrenheit, 38.3 degrees Celsius. B. Productive cough with yellow sputum. C. Respiratory rate of 32 breaths per minute. D. Oxygen saturation of 94% on room air. Diagnosis. The nurse is caring for a post-operative client who reports difficulty urinating. Which nursing diagnosis is most appropriate? A. Fluid volume overload. B. Impaired urinary elimination. C. Risk for dehydration. Or D. Acute pain. Planning. The nurse is creating a care plan for a client with impaired skin integrity. Which goal is most appropriate? A. The client will increase fluid intake. B. The client's wound will show signs of healing within 1 week. C. The nurse will turn the client every 2 hours. Or D. The client will verbalize an understanding of wound care. Implementation. The nurse is applying anti-embolism stockings to a client after surgery. Which action is correct? A. Remove the stockings only at bedtime. B. Roll the stockings down to the knees if they feel too tight. C. Ensure there are no wrinkles in the stockings. Or D. Apply the stockings after the client ambulates. Evaluation. Question 10. The nurse is evaluating a client's ability to self-administer insulin. Which action by the client shows successful learning? A. Drawing up regular insulin before NPH insulin. B. Holding the insulin syringe at a 45-degree angle. C. Injecting insulin into the same site each time. D. Massaging the injection site after administration. Assessment. Question 11. Which finding in a postoperative client requires immediate intervention? A. Mild swelling at the surgical site. B. Heart rate of 110 beats per minute. C. Urinary output of 35 milliliters per hour. D. Blood pressure of 118/72 millimeters of mercury. Diagnosis. Question 12. A client with limited mobility is at risk for pressure injuries. Which nursing diagnosis is most appropriate? A. Ineffective coping. B. Impaired physical mobility. C. Risk for infection. D. Deficient fluid volume. Planning. The nurse is creating a care plan for a client with pneumonia. Which goal is best? A. The client will be free from infection in 24 hours. B. The client will tolerate all prescribed medications. C. The client will maintain an oxygen saturation of 95% or greater on room air. D. The nurse will monitor the client's vital signs every 4 hours. Implementation. The nurse is reinforcing teaching about deep breathing exercises. Which action is correct? A. Instruct the client to inhale through the mouth. B. Have the client exhale forcefully. C. Encourage the client to use an incentive spirometer. D. Tell the client to practice once a day. Evaluation. The nurse has been monitoring a diabetic client's blood sugar levels. Which result indicates that the care plan is effective? A. blood glucose of 200 milligrams per deciliter before meals. B. Hemoglobin, A1C of 6.5%. C. Blood sugar of 250 milligrams per deciliter after breakfast. D. Client reports frequent urination and thirst. Assessment 16. A client with heart failure is experiencing dyspnea. What is the first nursing action? A. Perform a lung assessment. B. Administer a diuretic. C. Check the client's daily weight. D. Increase the client's fluid intake. Diagnosis 17. A client reports urinary incontinence after childbirth. What is the best nursing diagnosis? A. Impaired physical mobility. B. Risk for impaired skin integrity. C. Impaired urinary elimination. D. Anxiety. Planning 18. The nurse is setting goals for a client with chronic pain. Which goal is most appropriate? A. The client will report pain relief within 30 minutes after medication. B. The nurse will administer pain medication as ordered. C. The client's family will assist in pain management. D. The client will avoid all activities that cause pain. Implementation 19. The nurse is caring for a client with a wound infection. Which nursing action is a priority? A. Administer prescribed antibiotics. B. Encourage increased caloric intake. C. Apply warm compresses. D. Teach the client about infection prevention. Evaluation 20. The nurse is evaluating the effectiveness of fall prevention interventions. Which finding indicates success? A. The client reports understanding the safety plan. B. The client has had no falls during hospitalization. C. The nurse assists the client with ambulation. D. The client wears non-slip socks. Now let's see how you did on these questions. Here are the correct answers and explanations. Assessment. Question. The nurse is gathering data from a client with heart failure. Which finding should be reported immediately? Correct answer. Weight gain of 3 pounds, or 1.4 kilograms, in 24 hours. Explanation. A rapid weight gain indicates fluid retention, which can signal worsening heart failure and the need for immediate intervention. Diagnosis. Question. A client with COPD reports shortness of breath when climbing stairs. What is the best nursing diagnosis? Correct answer. Activity intolerance. Explanation. COPD clients often experience fatigue and shortness of breath with exertion, leading to activity intolerance. Planning. Question. A diabetic client does not understand why they need to check blood sugar daily. What is the best goal? Correct answer. The client will verbalize the importance of blood sugar monitoring. Explanation. The goal of client education is for the client to understand and adhere to care practices. Question. The nurse reinforces teaching on low-sodium diets. Which statement needs correction? Correct answer. I will use salt substitutes instead of table salt. Explanation. Many salt substitutes contain potassium, which may be unsafe for clients with hypertension or kidney disease. Question. The nurse evaluates pain medication effectiveness. What indicates success? Correct answer. My pain is 2 out of 10 now. It was 8 out of 10 before. Explanation. Pain levels decreasing show the medication worked. Question. A client with pneumonia has which finding that requires immediate intervention? Correct answer. Respiratory rate of 32 breaths per minute. Explanation. A high respiratory rate may indicate respiratory distress or worsening pneumonia. Question. A postoperative client has difficulty urinating. What is the most appropriate nursing diagnosis? Correct answer. B. Impaired urinary elimination. Explanation. Postoperative urinary retention is common due to anesthesia and immobility. Question. The nurse creates a care plan for a client with impaired skin integrity. Which is the best goal? Correct answer. B. The client's wound will show signs of healing within 1 week. Explanation. Goals must be specific, measurable, and time-limited. Question. The nurse applies anti-embolism stockings. Which action is correct? Correct answer. C. Ensure there are no wrinkles in the stockings. Explanation. Wrinkles can cause pressure ulcers and decrease circulation. Question. The nurse evaluates a diabetic client's ability to self-administer insulin. What action indicates correct learning? Correct answer. Drawing up regular insulin before NPH insulin. Explanation. Clear before cloudy prevents contamination of short-acting insulin. Question. Which postoperative finding needs immediate intervention? Correct answer. Heart rate of 110 beats per minute. Explanation. Tachycardia may indicate hypovolemia, pain, or infection. Question. A bedridden client is at risk for pressure injuries. What is the best diagnosis? Correct answer. Impaired physical mobility. Explanation. Limited mobility increases pressure injury risk. 13. Planning. Question. A nurse is creating a care plan for a client with pneumonia. What is the best goal? Correct answer. The client will maintain an oxygen saturation of greater than or equal to 95% on room air. Explanation. Oxygen saturation is measurable and specific. 14. Implementation. Question. The nurse reinforces deep breathing exercises. What action is correct? Correct answer. Encourage the client to use an incentive spirometer. Explanation. The spirometer helps expand the lungs and prevent pneumonia. 15. Evaluation. Question. The nurse monitors a diabetic client's blood sugar. What result shows effective care? Correct answer. Hemoglobin A1C of 6.5%. Explanation. A1C levels reflect long-term blood sugar control. 16. Assessment. Question. A heart failure client has dyspnea. What is the first action? Correct answer. A. Perform a lung assessment. Explanation. Assess before acting. Lung sounds can reveal fluid overload. 17. Diagnosis. Question. A postpartum client has urinary incontinence. What is the best diagnosis? Correct answer. C. Impaired urinary elimination. Explanation. Urinary incontinence suggests bladder dysfunction. 18. Planning. Question. The nurse is setting pain management goals for a client, which is most appropriate. Correct answer. The client will report pain relief within 30 minutes after medication. Explanation. A specific and measurable goal ensures effective evaluation. 19. Implementation. Question. The nurse cares for a client with a wound infection. What is the priority action? Correct answer. Administer prescribed antibiotics. Explanation. Treating the infection prevents systemic spread. 20. Evaluation. Question. The nurse evaluates fall prevention measures. What indicates success? Correct answer. The client has had no falls during hospitalization. Explanation. No falls is a clear measure of fall prevention effectiveness. Final recap. Assessment. Gathering data, like vitals and symptoms. Diagnosis. Identifying client problems based on assessment. Planning. Setting smart goals. Specific. Measurable. Achievable. Relevant. Time-bound. Implementation. Taking action such as administering medications, interventions, and teaching. Evaluation. Checking the effectiveness of intervention.